Due to the graphic nature of this program, viewer discretion is advised.
Get them on IV fluid.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.
Okay, my parakeet Harley just last week, Wednesday night, wasn't himself at the time. We thought we had a little boy bird, and just really ruffled, not eating, not chirping, not moving around, not pooping. So we knew about the ER clinic here, and brought him in, and then we found out we had a girl because she was egg bound, and Dr. Marla had to do surgery to remove the egg, and then we got to bring her home Saturday, and then we brought her back Friday because they had found another egg and she didn't pass it on her own, so they did surgery second time to remove it, and now she's spunky and sassy as ever.
This is the amazing parakeet. Survived 2 surgeries. I mean, isn't that amazing?
That is.
You don't know how amazing this actually is. Because usually even one on this small of a bird is a lot of stress on them, trying to take an egg out of that uterus, you know. And the uterus is, I mean, oh my goodness, the size of maybe my small finger, maybe, probably half of it, this width. And so you're working in tiny little, you know, and you're working fast as you possibly can, because they can't stay under anesthesia very long. But I call this the amazing parakeet. Yeah, she's amazing. Harley. So now our whole work is going to be to get her to stop producing them.
Yes.
So when you come back in a week, we'll give another Lupron,
Okay.
and then we're going to make sure that you start increasing that, you know, night time.
Yeah, we've been doing that,
Putting
taking
her to bed.
in a different room at 7 and getting her up at 8.
Good. Perfect. And then hopefully we can stimulate her to stop producing. I think during the winter you can lengthen the time, and then back in January and February is when they start again. They go through a breeding season. Okay?
And she's got her favorite fruit. She loves millets.
Oh, great. So for the medication? So like I said, we'll kind of hold right up above that, below that neck there. So she can't really bend down to bite and move it.
And then they open their mouth up.
And she won't.
There
she
you go.
goes.
You squeeze that in and she'll drink it.
Okay?
Yeah, there you go.
I had to bring in my dog Winston to have surgery, emergency surgery for a blockage because he was chewing in a rawhide bone and swallowed a big chunk and it got stuck in his intestines.
So he just got out of surgery, like about 15 minutes ago, and then we placed that nasogastric tube. He looks kind of scary, huh? With that big collar on and everything. You never saw him this quiet, huh? So he actually ate a rawhide, right, a couple days ago?
Yes.
And he's had them before, and they've always just...
It's been fine.
Yeah.
And this time, not so much. So.
Probably something that you're not going to want to give again.
Yeah.
Yeah.
He won't be getting those anymore.
Because they chew big pieces off of them sometimes, and
Yeah.
you never know, you know, if they chew them little tiny pieces, they'll pass on through, but sometimes, and they'll digest them, but if they're big, huge pieces, which we found here, in this case, it was about a chunk about this big, and it got caught up in the intestines, so.
Yeah, he's chewed on everything. And luckily, most of it's been passed, but he's torn big kongs apart,
Gotcha.
those out, and swallowed those things. And
Gotcha.
I guess we've got lucky so far, not this time.
Yeah. But he'll be here a couple days, so, and then you guys can maybe come and pick him up on Monday, huh? All right? And then you guys can.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, Metropolitan Fence, we're always on the level, and Camp Bow Wow, premier doggy day and overnight camps. And now, a word from our sponsors.
Welcome to Camp Bow Wow in Waukesha, the premier doggy day and overnight camp where a dog can be a dog. Our campers play all day in our 4 large indoor and 4 outdoor play yards. Watch your pup from anywhere in the world on our high-speed camper cams. Our certified camp counselors, spacious cabins with comfy cots, pup pools, and outdoor play equipment ensure that your pup has a great time. We're open 365 days per year for your convenience. Stop in for a tour and book a reservation for your dog's free day of camp. Visit campbowwow.com/Waukesha or call 262-547-WOOF for more information.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
The Humane Animal Welfare Society of Waukesha is so much more than a shelter. Our adoption staff, animal caregivers, and behavior department ensure the best possible adoptive companion. Our spay-neuter programs actively combat pet overpopulation in our area, and our animal rescue team safely returns lost pets back home. HAWS does one-on-one consultations, holds a variety of training classes and seminars, and even hosts camps for kids. Our shelter is and always has been open admissions and full service, providing resources for pets and their people for a happy lifetime together. HAWS, we're building a society that's humane.
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel, Personalized care for your precious pets.
Looking to get some training for your dog? For Pet's Sake is your one-stop dog training center. We offer all-inclusive obedience training, canine sports training, specialty classes, and more. We provide training classes in 3 convenient locations with our main facility in Mugwanago, which boasts a fully matted 5,200 square foot training hall. While in Mugwanago, check out our Bichon Buddy Rescue and take home your new pet. Bichon and Little Buddies Rescue takes in Bichons, other small dog breeds, and cats that need to be rehomed for various reasons.
Well, we dropped her. We're going out of town this weekend, so we dropped her off at the daycare, and she had her brother, another dog, and we thought everything was going to be okay. And about an hour after we dropped her off, we got a call from the daycare saying that she had vomited and that her tongue and gums were blue and she seemed to be struggling to breathe. So they rushed her to first another clinic, who realized that the situation was a bit more advanced and that we needed to come here. And we just got a lot of calls. We're out of town, like I said, so I had my aunt, who was local, rush here immediately to keep us updated, and they were able to incubate her, get her on oxygen, give her some shots to calm her down, and she was pretty sedated for a while, and they said that she was doing well this morning, but she vomited again, so they're gonna just be on the safe side, keep her overnight. And with the English Bulldogs, if they get a little too worked up, their esophagus or throat closes, and she struggled breathing.
We have Lexi's owners here, and they were coming to pick her up. It was pretty extravagant experience. She had been at the daycare.
Yes.
And this is the first time, and she has anxiety issues.
Yes.
But they thought you wanted to try her.
True.
Yeah.
See if it would be okay.
And it didn't work. She got super anxious, and then being a Bulldog, because they have the pushed-in nose normally, so they have a nose that they don't have big nostrils. That's normal in Bulldogs. They have the pushed-in face, and then that makes the soft palate that lays over the opening of the trachea. And then she got so super excited that she started, panting heavily, and the larynx got swollen, and it closed up, and then she came in here cyanotic yesterday. And we had to grab her from the owners, get her in the back, and intubate her. I mean, your mom, that was your
Oh, that was my aunt.
Yeah, she had said that, let me talk to the owner, and like 3 seconds later we heard, yes, do anything.
Yes, yeah, we were out of town, so we sent my aunt to try to take care of everything.
Right, so, but we intubated her and got her started on a lot of drugs. And I think that we had to keep her calm because she kept waking up with a tube in.
True.
And so she was heavily sedated all night. She didn't even wake up until this morning.
Okay.
But she woke up so easy, I thought better to get her at home. But now because she just vomited, we're gonna keep her here. So.
This is Onyx. Onyx is a 17-year-old cat, and Onyx actually belongs to one of the nurses that work in the ICU. Onyx wasn't feeling very well and not eating, and so the nurse, Callie, who owns him, brought him in, and we ran some blood work. And unfortunately, Onyx has kidney disease. We have the blood work right here, and I don't know if anybody can see these high values here. This is just the complete blood count, but the kidney values are right here, and everything that's highlighted in yellow is not normal. So we are treating his disease with fluids. Here's a bag of fluids right here and a pump. What we do is just give him lots and lots of fluid to try to dilute out the toxins that aren't being filtered from the kidneys. She will be here for a couple of days, and we will be rechecking the kidney values. So we'll be following up and doing further tests even after she goes home.
So this is a patient that we saw back in October that had some significant periodontal disease, and because of the periodontal disease we had to remove some teeth, but we also elected to save some. So that's what we're looking to do today, is to reevaluate how well we're doing with our periodontal therapy. Periodontal disease comes in 4 different stages, and in any given mouth there's several stages. There's very severe disease and not so severe. So the animals that have stage 4, or the teeth with stage 4, we remove those and we save the ones with stage 2 and 3. So that's exactly what we did back in October, and today we're checking to see how successful or unsuccessful that might be. So our first step here is periodontal probing. We've extracted some of these front teeth and we're pretty happy. The owner is doing a great job of brushing. So what we're looking at, we're taking a periodontal probe and we're going around the teeth, and we're really looking to look for pockets, any sign of infection or disease. I have already cleaned these teeth. This area here is called the furcation. There's a slight divot where the roots, there's exposure. So we have a little gum recession with this tooth. But we did some bone grafting about in October, and now after the bone grafting it looks like the gingiva has reattached nicely and we don't have pockets anymore. We're not seeing bleeding, so we're pretty happy with what we're seeing. So we have pretty good periodontal health. We did our periodontal therapy where that pocket was right in this location. We had put a bone graft right in this area right here, and it looks like it took pretty well and the gums are doing well. The next step, we've done the probing, we've done the x-rays, and now we're going to do charting and looking for any other things that might be new. So we have extracted number 1, 2, 3, 4, and 5. The third molar is fine. That completes the periodontal assessment on the right side of the mouth. So we're back with Bella, and now she's woken up from anesthesia. We did some periodontal therapy today. We cleaned, we x-rayed, we probed, and we polished her teeth, and so she's trying to tell us she's just in that process of waking up. One of the things that we're going to add is Oravet. Oravet is a product that helps reduce plaque retention, and that helps reduce plaque is the cause of bacterial periodontal disease, and so by the use of this along with teeth brushing every day, we're going to help control Bella's periodontal disease.
Zoe is about a 5 to 6 year old Yorkshire Terrier that was diagnosed with inflammatory bowel disease. That's like irritable bowel syndrome in people. And at first, for the first year, the dog was being treated with steroids and a hypoallergic diet because the signs were very mild. There was some vomiting, diarrhea, and weight loss. Dog did fine for a year, but then it presented here for having a big bloated belly. And we found that the dog has ascites. And he has ascites, that means water or fluid in the abdomen, because he's leaking proteins from not, when you have irritable bowel syndrome and it gets very, very severe, suddenly now you're not able to metabolize and utilize all the proteins that you take when you eat them. and they're actually going out of the system instead of being, because a lot of times when you eat protein, it goes into the intestinal tract, you reabsorb them into your bloodstream, and then they're put back into for muscle, for all kinds of things in the body cavity. When you're not, because there's so much inflammation in the gut, the body isn't absorbing any of those proteins, and they're just going out of the body system, into the stool, into the urine, and then when you don't have a good amount of proteins in your bloodstream, you leak out into your belly or chest cavity. So cute. Gave a plasma transfusion, so we gave some albumin back to the dog, and then we have started on steroids and cyclosporin to try to combat that inflammatory bowel disease. And we're going to start a low-fat diet and give her vitamin B complex to help absorb food better and not lose those proteins. So right now, today, we're going to try to take that fluid out of there, because that actually puts so much compression on the intestinal loops of bowel that then the dog doesn't feel like they want to eat. So we're going to give a little mild sedation. We're using propofol. So this is actually what they do in people too, and the reason I know this is my dad had ascites, and they do exactly the same thing. They prep the belly, put a drape on, and then sterilely they put a needle in and remove the fluid. So.
Because you love him completely, because he is part of your family. When your pet needs emergency care, you want the very best trauma and critical care specialist standing by. You know there's only one place you can trust and always count on.
I thank Mega and Dr. Dale Crescent for the medical care for Bailey.
Dr. Crescent and I are very happy that we were able to provide medical care for Bailey and all the other Milwaukee Brewer player pets.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
For over a decade, Fetch magazine has examined the unique bond humans have with their canine companions by publishing popular dog-related topics. With a strong commitment to dogs in need, Fetch also prints local adoptables in each issue, supplies affordable advertising to businesses, and gives rescues 30% off of ads. This year, Fetch is offering $15 subscriptions for your convenience. For more information, visit www.fetchmag.com or pick up your free copy at a local pet establishment near you. Go Fetch!
There's been a lot of excitement at Haws this year, from newsworthy animal rescues to helping everyday people adopt a new family member. We at Haws know we couldn't do it without the help of people like you. Help us continue our success in fulfilling our animals' needs by donating to the Haws Two-Step Project. By making a general donation and pledging to donate toward our much-needed future expansion, you help us continue the Haws mission of helping animals in need. Log on to hawspets.org and donate today.
Humane Animal Welfare Society.
Hi, Boston. Take it easy. Take it easy, buddy. Take it easy.
So excited.
So, oh, he's much better today. Are you leaving him go a little bit? Just just a little. With a little bit of support, he's actually today able to put pretty much weight on both back legs. So we've done laser therapy on him too, and I think we'll have DeAndre do laser therapy today again. But he's supporting weight because his fractures are on his left hand side, so he's supporting weight on this right hand side now, which is what he should be doing. And the left-hand side is a little bit less mobile, but he's much better than yesterday. Are you holding him at all, Andy?
No, not much. He's using Madalena.
So this might just be a time factor. I think we're going to have to put in a urinary catheter into him, though, to make sure that he's able to urinate. I think it's more of a pain thing. You got him? Mm-hmm. We're not able to express his bladder. Hey Dee, I think we're going to put a urinary catheter into Boston. She did? Oh, okay. Oh, he did. A big spot or? Oh, good. Okay, so we've got him urinating. He's actually getting better. Can you do laser on him again today? DeAndre did laser on him yesterday, so we think. And then with anti-inflammatory and pain medication, we can see a huge improvement of him. So right at this point, I don't think we're going to recommend surgery. So good.
Today's show was brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.